Osteoarthritis. We all heard of it. Degenerative disc disease. Maybe a lot of us have heard of it. Are they synonymous? What's going on? What's osteoarthritis? What's degenerative disc disease? What can we do about it? Why should you come to a chiropractor if you have that? And what else can you do? Well, when it comes to osteoarthritis, this is basically a wear and tear form of arthritis, where now we have lost that cartilage between the joints and the bones approximate and the bones are rubbing on each other. And let's talk about it really relative to the spine here, where we call it degenerative disc disease. So here we have the spine, we have the occiput here, we have the circle of Willis, and you have things like the basilar artery, middle cerebral artery, all this stuff in there, right? You have the nerves here coming out of the sides, these little holes. We call these intervertebral foramen. A foramen is an opening, so that makes sense. Intervertebral, inter's between, and vertebral is the vertebra, right? So there are little openings between the vertebra, and these nerves come out of them. And what do they come off of? They come off of the spinal cord, you can see, traveling through here. And this is C1 here. It should really be over the cord as well. But, you know, my thing's seen some work. I'm doing this all day, talking to people about it. And this thing is sturdy. So what's going on, first off, with this whole curve thing we got going here? Well, your spine has a curve. And the reason we're talking about this is very related, very much so related to degeneration in the spine, aka degenerative disc disease, aka you could say arthritis of the spine, osteoarthritis of the spine, right? Many different types of osteoarthritis. This is the wear and tear arthritis in the spine that I see every single day in people as we age, right? And it's worse in some than others, and we're going to talk about why. So with this curve, now this is the front of the spine, and this is the back. These shark fins are the spinuses. So when you feel the back of, say, you know, right here, and you feel that bump, well, that is your vertebral prominence around, you know, C7. It could be T1. It's different, you know, in different people. It's typically around C7. And so your seventh cervical or neck bone, right, we could say. And so it has this curve, front to back. And it's going like this, right? As you can see, if I'm standing like this, and this isn't that exaggerated. It could really be more exaggerated of a curve. Really should be more, you know, like that. But they had to screw this thing together and whatnot. The curve is important for absorbing shock. So that curve helps your body to absorb shock in these little cushions here that sit between the bones. These are intervertebral discs, because again, inter's between vertebral vertebra discs. They're little cushions, little cartilage cushions that help to absorb shock from the spine. So when you have a curve, that's great, right? If you take your finger like this and you press on it, well, that's not so stressful on the joints. What happens if you lose the curve? So say that neck curve that's like this now goes like this, because you're like this all day. You know, everybody's doing this, reaching forward, typing, whatever the hell you're doing, texting. Text neck is an epidemic, right? Well, you lose that curve, and now it's straight. Take your finger straight and go like this and jam it. Doesn't feel good, right? So you're putting a lot of pressure on these joints here, and it's no different in the spine. When we look at the spine, if we lose this curve and the cervicals even can go the other way, that's a lot of vertical pressure. That vertical pressure is coming down on these discs. So what's the issue there? If you start to crush these discs and they wear away, what does that mean? It's just going to be bone on bone, right? If it's bone on bone, look what's between the bones. Nerves. So if these get closer, how do you think the nerve's going to be happy or not? What if that nerve goes down your arm from your neck, right? Because these nerves travel off of your spinal cord. They branch off into other nerves. They control everything in your body, right? They branch all over the place. And so if it controls the movement of your arm or things you feel, you think it's going to move as well or feel as good, right? Oh, of course not. You know, things have changed. The impulse, the signal that it is transmitting is no longer functioning properly. So when you lose these discs, now you have the bones on the bones, right? And so this is the beginning really of degenerative disc disease. Now, it gets worse. The body is extremely intelligent. And albeit it's extremely intelligent, it takes care of immediate needs, what's necessary, right? And so what it does to stabilize this joint is it adds bone. So it starts to add bone here. It adds bone, it adds bone, it adds bone. And when you see these bone spurs, we call them, we also call them osteophytes, they're good for stability. Now, adding bone could be good for stability, but it's not good for range of motion. right? You try to turn your neck, these bones are grinding on each other. It's obviously not good for range of motion. And it's not good for the structures around the bone because it's added bone. And now that bone is pressing on all sorts of things. And it's not just nerves, it's also blood vessels and muscles and all these other things in there, right? And so without knowing any of the anatomy really, you just know it's not a good thing to have that much extra bone pressing on stuff. Can I go into your spine and remove the bone? No, I can't, right? But I can help to prevent that from happening in the first place. And that's when you come to a chiropractor, right? And it's before, in a prophylactic or a preventative sense, we could say, coming before the degeneration has gotten so bad. All right. And so, how does that happen? How is chiropractic going to help that? And also, what can we do once we're past that point? Okay. We'll talk about that. So first, let's get through this. It adds bone here. It's kind of the story degenerative disc. It then starts to add bone back here. And these are the facets, we call them. And you see this movement here. You see this joint right under my finger here. You see these little things locking in. They look like roof shingles, I like to call them, to patients. Those are facets, all right? And around them, by the way, is a joint capsule. Now, that joint capsule contains these, because they can't just be naked like this in the body, free flow. They go all over the place, right? So between them, within that joint capsule, or that kind of bandage, if you will, is synovial fluid, just like there's synovial fluid in your knee joint or in your elbow joint. And so when you get an adjustment and these move, well, we said there's a capsule around them, right? They stretch the capsule and the fluid expands, and these little gas bubbles, nitrogen gas bubbles here in the fluid, they pop. And that's the sound you hear with an adjustment, fun fact, right? If you're wondering about that, and we talked about that in One Wellness. But in degenerative disc disease, now we have more bone here, we have less disc, more bone, and what happens is the bone starts, as adding is encroaching, and it can choke that nerve, right? Now on top of that, after it does that, it starts to add bone. Even worse, guys, in the canal, right? Show you like this, in the canal. Okay, so coming right down Broadway here, the vertebral canal, if we're going from top to bottom, okay, or superior to inferior, we could say, you see this canal houses the spinal cord. And what if we have more bone added here and here on the inside and here? It's going to choke the cord. We call that canal stenosis. Or if it was at the foramen, you'd call it foraminal stenosis, right? And if you've had imaging, now you know what they're kind of talking about. When they say stenosis, it literally just means narrowing, okay? Now, here's the other thing, is when you have a lot of pressure on these discs, even if they're not fully worn away, well, they become weaker over time, right? And if you're not getting blood flow to them and delivering oxygen and nutrients to them, they're more likely to rip and tear. And so what happens if they tear? Let's look. See where it is. Here, good. So if this were to tear, then it could press out. The jelly in this jelly cushion here in the middle can leak out, and the fibers are torn on the outer part of our cushion here, and that can press against nerves, and that can cause pain and dysfunction as well, right? So how do we prevent this? Well, firstly, how we prevent that is by having good posture all the time, having strong enough muscles that can support your posture all day to keep you in the upright position, to keep you having a nice curvature front to back, and so on, all the way down the spine, okay? And that's going to reduce pressure on those discs, and it's going to slow the onset of degeneration or degenerative disc disease, or we could say osteoarthritis really in the spine. Right? And so that's definitely one thing. Another thing is you want to not be overweight, right? If you're overweight, what's going to happen is you have a lot of pressure from all of this meat on your body hammering down all day from gravity. It's like you're wearing a weight vest all day. How do you think your spine's going to respond to that? Right? Well, that's going to really crush those discs. So what we want to do is get blood flow to the discs. They don't make blood themselves. These are avascular. These are avascular, meaning without vascular blood flow, right? So they don't have a source of their own blood. They don't make their own blood. They actually get it from these tiny little capillaries that sit, if I could bend it, if I could peel that back right in the bottom part of this bone or the top part of this bone, right? And they feed them, but you need to pump the blood into them. It's not just being automatically fed, right? And so how do we pump that blood? We call that imbibition, that pumping of blood into these tissues. And it's essential to keep them nice and thick and healthy, right? And you look at marathon runners. Marathon runners have half the rate of knee arthritis as non-runners. So what? Are you kidding me? Again, marathon runners have half the rate of knee osteoarthritis as non-runners. That shows how important it is to get blood flow into the cushions. They're constantly delivering blood into their knees. They're getting blood flow there. The worst thing you can do is just sit all day. Now, another thing that's bad is being in a malposition all day, or a position that is not beneficial for your spine, for your skeleton in general, in terms of the mechanical stress all day. And so if somebody were sitting with a jackhammer constantly like this, right, your bones are going to respond by fortifying, and they're going to make more bone, and because the discs are just getting hammered, right? So, things like that as well can play a role in degeneration. Chiropractic adjustments improve blood flow to those discs. They temporarily take pressure off of the nerves that we were just looking at, right? They feel good. They help you release good endorphins. They loosen muscles that attach to the spine, promote the elimination of toxins through the cerebrospinal fluid that surrounds the spinal cord from the spine, because that's important. It's not just feeding and nutrition, it's removing toxins as well, and other things, of course, right? But when we talk about the discs here, as we're talking about degenerative disc disease, the adjustment helps to feed blood to the disc. And so does traction and flexion distraction, where the legs move up and down, and it opens the space between the bones in your low back. So if somebody were laying on their stomach like this, and I have them on the flexion distraction table, their spine's going like this, like this. Remember, this is the front of their body, this is the back. They're laying face down. And so that helps the discs to go this way, away from the nerves, which means they're less likely to press on them and cause pain, which is a good thing. That makes it good for herniated discs, right? But also it's pumping blood, as would walking or biking or swimming, all these things, into the spine, right? And so the adjustment does the same thing. And so it slows what we call sclerosis, or that hardening of the disc, that adding of bone, that conversion of the cushion into a more bony structure. Okay, now once you have degenerative disc disease to a significant degree, now say you're already there, and you have stenosis, and you have these symptoms where your arms are numb and tingling or burning, and you're getting muscle weakness, you can't really move your legs as well, you're tripping, all these things. Well, guess what? You got to go to a neurosurgeon at that point. They're going to remove the bone, right? They're going to go in there and they're going to shave away the bone. Maybe they'll put some artificial discs in there to make some more space again between the bones, and all sorts of things, right? But before you get there, you want to see your chiropractor, and you want to lose some weight. And if you are there, again, and have healthy diet, of course, right? And just be healthy in general. I mean, it's good for so much more than just your spine and your discs, right? But when you're at that point, aside from losing weight, right, we would like low impact exercises such as Tai Chi or yoga or Pilates, walking, aquatic exercise is great, just aerobic exercise in general, light weight-bearing exercise, light aerobic exercise. That's great stuff to just help to keep your spine as healthy as possible when you're already at that point, and beforehand, right? Of course. So, that's pretty much the story. And what do we have in terms of supplements? If somebody says, what are some natural supplements that I can have if I have degenerative disc disease or osteoarthritis? Well, we know our top ones are omega-3s, curcumin. The omega-3s are EPA and DHA, of course, right? You can get them in algal oil or krill oil. It doesn't have to just be fish oil, because a lot of fish oil is rancid, right? I would say algal and krill are definitely, above fish oil on average. And you'd want 3 grams combined EPA and DHA a day, right? To reduce joint stiffness, improve joint mobility, at least to the greatest degree. But again, before talking about dosages or anything, lifestyle modifications, go see your chiropractor and just lose some weight, right? These are all way more powerful than supplements, okay? Just as a necessary premise here. Now, we have omega-3s, we have curcumin, like we said, we have undenatured type 2 collagen, that would be 40 milligrams a day. Curcumin would be 500 milligrams 3 times a day, 1,500 milligrams a day, combined with piperine, say 20 milligrams of piperine for every, 500 milligrams of curcumin, something like that. Improves the absorption of it, right, is what's important there. We have Boswellia serrata, boswellic acid. Now, you can get patented forms of these, and you have to take a lot less, like BCM 95 or Mariva for curcumin, or Aflapin or 5-loxin when it comes to Boswellia serrata. And instead of taking 1,800 milligrams of Boswellia serrata 3 times a day, you could take, say, 250 milligrams, 150 to 250, I believe, something like that, for Aflapin or 5-loxin, right? So, you can look at that, talk to your doctor about that. Black cumin, pycnogenol, methylsulfonyl methane, MSM, and of course, chondroitin and glucosamine. If it's not already really degenerated, if it is, they're not going to help as much. They'll help to keep it thicker, the cartilage that is, in the first place. So that's kind of all-encompassing degenerative disc disease, what's going on, and a little bit of what you can do for it. And I hope that was helpful. So who do we got on here? Cheyenne, what's up, baby? How you doing, girl? Ma, love you. Not by coincidence, you're the best. That was delicious yesterday. Thank you for a great dinner. Jan Barry Martin, Kumo Dave. It's a phlegm thing, Billy. Love Fana Fanuguna. What's up, Jay Shaper? Jay Keys, Takatel. What's up, Erica? Tom Pasilico. Is that Tom Pasilico that I was hanging out with as a kid? How are you, brother? Shit. I hope you're doing great. Johnny. The real gay Oran. Okay. Tommy Reed. Clara. Hello, my dear. Brandon Malone. S. What's up, beautiful lady? SBU Bowling. Sevilla is up in the hizzle. How you doing? Bitcoin. Antonio. And Piva Couture. Thank you. Oh, good, I am. Thanks. Ben, what's up? As for now. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have an amazing rest of your day. Thank you so much. We got a patient coming in a few. Finished just in time. Happy when wellness. What up, Beasley? See you later.